Welcome to Midwives Uncut.
Cha-cha. But we are back in full force and ready to touch on some fun topics that we think our viewers are interested in hearing. Today's topic is going to be about midwifery care versus OB care.
During the care, the style, because it's really important that people understand there is a huge difference. So when they are choosing their provider, they really want to choose someone that's in line with what they are looking for.
Yeah, and also like to really, I feel, to understand that, I think it's something that's kind of lost, is the first person you should go to when you are pregnant is a midwife.
Well, that's how it is in a lot of the other parts of the world.
Yeah, well, that's probably why they have better birth outcomes.
Correct.
Because the OBs are really there for like risk factors. Yeah, like, okay, we have high blood pressure we can't control. Okay, well, let's get you to the specialist. So I just feel like when we use the right provider for the right, issue, you get the better care because that's the person that specializes.
And the better outcome.
In that. Yeah, exactly. So we will break it down, comparing the two cares. So let's start off with the model of care first.
Okay.
Yeah, right?
You want me to do it or you want to do it?
You do it.
Okay, so the midwifery model of care, whether practiced in clinics, private homes, hospitals, or birth centers, has at its core the characteristics of being with woman, which that's what midwife stands for.
This is the midwifery model of care.
Yes. Listening to clients, sharing knowledge and decision making with clients. The goal of the midwifery model of care is to support birthing people and their families in the process of birthing their babies safely, unhindered, and with confidence. And that's really important because in general, what that all means in a nutshell is that the woman should be in control of her care. She should understand what's going on. She should know the terminology that's being used. And if she doesn't, she should be explained what it means. Why are we doing these labs? What is it for? Are there other options? If there is something going on and there's recommendations, okay, well, what are my different recommendations? It shouldn't be just cut dry. You have to take this pill, you have to take this medicine. No, you have the option of doing that or the option of a natural remedy.
Sorry. But also, like, when you start your care with the person who specializes in low risk, you really get more of a comprehensive type of knowledge with your pregnancy journey, right? You're not missing out on things because you're going straight to a specialist and you forgot, the specialist doesn't focus on like education, nutrition, this and that. So you want to make sure you start getting everything, and then if you have to zone in on certain areas, you zone.
Right.
I guess you do one side, I'll do the other, right? Okay. So model of care for OB, the traditional medical care model is disease or illness based. Using this biomedical approach to problems, symptoms elicited from patients are compiled. Is that correct? Okay. Based on these symptoms, a differential of possible diseases or illnesses is constructed. Medical model of care focuses on managing problems and complications. Labor births are dependent on technology. So
that's a huge difference.
It is a huge difference because, again, it's more focused on dealing with a problem, which is what they are trained to do, where we are trained to get this woman ready for a healthy journey, right?
Correct. And now let's talk about the cost, right? So the cost for a self-pay insurance can vary based on plan, depending on where you're at, depending on your out of pocket. There's so many variables when it comes to insurance, but we're just going to focus on self-pay, right? Okay. So for midwifery care, typically you're going to see anywhere between $6,500 to about $7,500, depending if you're birthing in a birthing center or birthing at home. It also depends on state as well, but in general, like here, that's what it would be.
We're in Florida.
We're in Florida. So, the fee includes total care, meaning it's a total package, right? Midwifery services are packaged to include total care. This would include prenatal care, standard labs, one ultrasound, concierge services, Concierge service is you can call your midwife at 10 o'clock at night because something is happening and you will not get an answering service. You can text your midwife with some questions or concerns. You can email your midwife with, hey, what vitamins do you think that I should take? And that is considered concierge service.
Well, it's a lot more than that, but that's the peak best part of it.
Right, that's part of it, right? But concierge service encompasses a lot of things that we do after hours that people don't see in the behind the scenes.
We don't get credit for.
Right. So it includes the your classes, child birth education classes, labor management, facilitating birth, and if there is a transfer, facilitating a transfer, and making sure that all medical records report everything is given to the other facility and provider. And
it doesn't magically get there.
Right.
There's somebody behind the scenes taking care of all of that.
Absolutely. And your postpartum care for up to 6 weeks. And we see our moms a lot, okay? We see them anywhere between 2 to 3 days after, 5 to 7 days, 3 weeks, 6 weeks, a lot. Why? Because we are following your progress on how you are doing physically, emotionally, and mentally. How's breastfeeding going? You know, like, how are you healing? There's so much that can happen within that time frame. And breastfeeding too.
That's a lot.
We want to monitor breastfeeding, we want to help you, want to, you know, obviously catch things if they are presenting at the moment without letting them get to a extreme level. Right. So
now, if we're looking at that cost based on the medical side, this is for doctor's office visits only. So we have not included the birth at the hospital, right? This is anywhere from $7,000 to $10,000. Remember, self-pay. And this is going to be covering your OB visits, the prenatal and the postpartum visits. Which, what do they do? One postpartum?
They do.
They'll see you.
Right. So in the hospital, they'll come to see you about 2 days. Usually, I will tell you that the nurses do most of the work. The nurses are really the superstars, I feel, especially they do a lot of work.
They do a lot of work.
And the OB will come back to see you. Everything's good, great. Yeah, I'll see you in 6 weeks usually. For
some reason I don't count that. Yeah. Right.
They will see you in about 6 weeks after that. So once you get discharged, then at their 6 week postpartum, they will see you again. If you had a C-section, then they are required to see you 2 weeks.
2 weeks
and
typically,
then
the 6. Well, sometimes they don't even do. Well, no, I think they do the 6 weeks still.
Yeah.
So that's just for their visits.
Correct.
Really? And where did we get this information again?
So this was all updated information from ACOG, from different studies that were out presently in 2023. So this
we didn't do our own study. We took from updated studies.
Exactly.
Yeah. So now go ahead over visits.
So what's going on in your visits, right? So prenatal visits with your midwife will be about 45 to 60 minutes, just depending on what's going on, sometimes longer if
That's
you need more time.
in-person contact time, not waiting.
Oh, right, exactly, in person. Midwife does vitals and labs. We do our labs in-house, so we don't send you out to a lab. Some other midwives may, but typically I would say that they do their own labs. They discuss nutrition, supplements, exercises, lifestyle, and ways to be and stay healthy. Because ultimately that's our goal, is to educate you on how to stay healthy so that you can stay low risk. They make sure to answer questions or concerns before the client leaves. So if you have a list of questions, that's the time that we go over it. They feel it's important and necessary to have the partner or family involved during visits to help them understand ways to support the mom. Why? Because they are very much a part of this process as well. And they are most likely going to be your support system when you're in labor. So they should know what's going on. They should feel comfortable with your provider, just like we have to feel comfortable with you. So having your family or partner come to your visits is going to help that the whole process is cohesive.
Now, on the flip side, when we are going to an OB, typically the prenatal visits are going to be, in-person time, 10 to 20 minutes. And I think 20 minutes is being generous, just from experiences from clients that we have been receiving.
Well, I had an OB with my baby, my first baby, and you had OBs too. And that was pretty much what it was.
Yeah, although I really love my OB. He was so sweet.
That's different.
Right. But it was still short. So the PA or nurse does the vitals and the labs prior to the OB coming in. And actually, sometimes you get your full visit from the PA or maybe like somebody else.
Assistant.
Yeah, or nurse practitioner. And then you will meet your OB at least once at some point during the visit. Because I do know there's a few clients that go and they don't have not yet met the OB, which
Correct.
I find fascinating. So the OB will go over any recent labs and we'll usually talk about concerns. And they're going to listen to the fetal heart tones, and they tell you when to schedule your next visit. This is not a breakdown of trying to bash any profession. This is simply an honest breakdown of what we have not only received from clients, but what we have been researching and confirming, and just so that you understand the difference between the two.
Right. Now let's talk about concierge. Now, concierge service, this is what it encompasses. Midwife is on call for you 24 hours and can be reached directly on her personal phone for any questions or concerns, and can communicate via text. Childbirth classes are included in that concierge service, access to herbal homeopathic remedies during labor, and even during the pregnancy stage 2. In-depth breastfeeding support. Postpartum visits are done typically 48 hours, 5 days, 10 days, 3 weeks, and 6 weeks, as we discussed. A postpartum kit, including herbal bath, cord care for the baby's umbilical cord stump, is also provided after birth. And usually you're given like a lot of postpartum instructions with techniques and different things so that you can hopefully have a much healthier, smoother postpartum care.
I will say this, when I delivered at the hospital with some of my kids, I was really, especially my first one, I was like, I don't get like a booklet? Like what I'm supposed to do. I genuinely felt like I was just given this really important thing, but with no instructions with
It's
it.
human is
Right
now.
I was like, but where's the
I have to
instruction
take it
kit?
home?
Like, what do I do? And so I think when we developed our postpartum, we really wanted to make sure moms felt like they had some type of guidance,
right?
You know,
it's hard, it's overwhelming, and it can be really scary sometimes if you don't have like support from family or friends. You're going home, just you and your partner, and you look at each other like, what the hell did we just get ourselves into?
Did. I was like, what am I supposed to do here? I have no idea. So now concierge on the other side, on the medical side, you're going to be looking at an OB team, which has an on-call schedule and an answering service for after-hours calls. So typically the calls will come in, the nurse person, they'll get screened and they'll get text out, and if they're an emergency, you'll get a call back. If not, then you wait till the next morning and then they'll return your call if it's a work day.
If it's a business day.
If it's a business day,
correct,
right.
Yeah. We work on weekends too.
We just can't help ourselves. It's in our nature.
Exactly.
We could probably be like that and not, but that's terrible. And that's just not midwifery care.
No, it's really not. Right. Care. Labor management included in your total package. And basically, we are there the entire time. We don't come in just when you're ready to push. We are there from the moment you check in and you might be in like kind of early labor or active to the moment that baby comes out and postpartum. Mm-hmm. So we are there doing vitals intermittently. We're there, trying to respect your space and making sure that we don't change the energy. So if the lights are off and we have to do vitals, we leave everything off. We really try to keep that setting so that ultimately you can feel comfortable and safe within that setting and relax to be able to have a nice, easy, smooth birth.
Yeah, we're like setting up the frou-frous, the lights, the aromatherapy. Mm-hmm. We're really trying. This is not within our job duties, but we certainly know that if we make you comfy, then the outcome typically is going to be better.
Absolutely.
So,
and that can be anywhere between 2 hours to 34 hours.
Or more,
because we've been at birth that long.
Just depends. So the national average for pregnancy and newborn care is about $30,000 for a vaginal delivery without complications and $50,000 for a cesarean section, according to Truven Health Analytics. But your actual cost could vary widely up or down based on your insurance. So that's for labor management on the medical side of it. Again, ours is just included in that base
already
price.
Included in your package. So postpartum care, midwives on call for questions or concerns and provides, as discussed, 2 to 3 days postpartum visits, 7 to 10 days, 3 weeks, 6 weeks. And during those postpartum visits, we're also taking the time to answer questions, go over breastfeeding technique. Let's change the position. Let's help you with the latch. Let's evaluate if there's a tongue tie. There's so many things that are going on. And this is to support and manage the care of mom and baby, breastfeeding support and advice, postpartum depression evaluation, and it's really an overall well-being of the entire family. So, I one time had a dad that had postpartum depression. I had never even heard of it prior to him having it, but it is an actual disease that exists for dads. And so I was the one that went and talked to the mom, and we were able to get him some resources after my evaluation was like, yep, this definitely sounds like it. And we were able to help him. And so when we say for the whole family, that's what we mean. You know, if there's something going on between mom and partner or like the other sibling, we try our best to really help with resources, or at least try to find people that have the resources, like a postpartum doula, if anything.
Right.
You know,
there's a lot of options out there.
Oh yeah.
So the postpartum care on the medical side, nurses come into the hospital room to discharge you, and they do your vitals, of course, during the time that you are there. They go over discharge instructions, which I personally found to be very minimal. And then you will see, if you have a C-section, you're going to see the doctor at the 2-week visit in the office, and then also always, no matter which way you flip it for your birth, 6-week postpartum visit for all clients.
And that may include contraception.
Right, exactly. So
for us too, I forgot to mention
that. Our 6 weeks as well. We go over, preparing for if you want to have another baby, or if you're going to wait, and what's the recommended time to wait. And so we do a lot of family counseling afterwards to, I guess, what's it called? Family planning.
Family planning is included in the 6-week visit, but we also go over, for example, if the mom needs a pap smear, we would do it there. So there's a lot of things that happen at that 6-week visit as well.
Yeah. So just to give you guys an idea of the difference and why it's really important that if you are low risk, you want to make sure you are seeing a low risk specialist, midwives, because we really do. That's what we're trained for. We cover a wide area of things that benefit low risk women. And so I just feel like people might forget about this and not think that's important, or not think this is important. And the reason why we're taught all these things for our care is because each area plays a role in ensuring a good outcome.
Well, also it's to ensure that everyone is educated on understanding the difference, because if you are the type of person that is absolutely 100%, yes, I want everything the medical way, then that is definitely the place that you should be. But if you are the person that is like, no, I really want to learn about what, supplements I should be taking, what nutrition I should be having, and I really want to have that personalized care, then midwifery is the way to go.
Yes. So next video,
we'll see
we don't know. So you're just gonna have to stay tuned to figure it out.
Going on a whim.
All right. So you should subscribe below and join us for our next videos. Thank you so much, and have a good day.